Hey everyone, my name is Ricky Bouncer. I'm Director of Crisis Services here at Oaklawn Psychiatric Center. Welcome to our Crisis Center located in South Bend. We are in the Epworth building located at 420 North Niles Avenue. We are Suite 100. If you're looking at the front entrance of Epworth, we are right to the right underneath the green awning and the sign that says Oaklawn Crisis Center. So when our guests come to the Crisis Center, we ask that they buzz into the doorbell and one of our staff members will let them in. From here, we'll enter into our front lobby. And when our guests come into the front lobby, they'll be met with a supportive staff member who will ask them to complete some basic paperwork so that we can get their chart open and start with the intake process. At that time, we will ask our guests to lock up their personal belongings in these lockers, as well as go through our environmental care screening tool so that we can help ensure safety for our guests and others while on the unit. Once that's done, we'll bring the person into our admissions room here. And at that point in time, they'll meet with our medical staff to complete a brief health assessment, as well as with one of our clinical staff members to go through our clinical screening. If our guest clears through those processes, we'll be able to get them admitted into the crisis center. So we'll walk them over here to our crisis unit door. And at that point, we'll enter the unit. As you can see, we have a nice open living room format here with big comfy recliners, as well as some tables so that our guests can do paperwork and maybe participate in other activities while on the unit. Our crisis center staff will work out of this central location here, where they'll have clear line of sight of all of our guests and be able to assist as necessary. We do have 2 bathrooms on the unit for our guests, as well as a private one-on-one room so that staff can have more private and confidential conversations with our guests. Over here on this side of the crisis center, we do have 3 more isolated chairs. If somebody's wanting a little bit more privacy and wanting to be by themselves a little bit more, they will have that option to seat at one of these chairs. And similar to our front entrance, we have an entrance at the rear for first responder drop-offs. So when one of our first responder partners is with an individual in crisis, they can come here to our rear entrance, buzz in just like we would at the front, and at that point in time, one of our staff members will buzz them in. So after our first responder partner enters the back door, our staff will come meet them here at the rear door. And at this point, we will escort our first responder partner and the person in crisis down the hallway to our admissions room to continue on with the intake and admission onto the crisis unit. And once a guest is admitted on the unit, they will have the opportunity to complete a full biopsychosocial assessment for outpatient services, a possible referral for medication management, meet with a case manager for insurance and other benefits, as well as a peer support professional for linkage to the recovery community. At discharge, our staff will also be doing a heavy amount of follow-up with our guests to make sure that those linkages to the community and to those resources in the community have been made, and that the individual has been working on their path towards wellness and recovery.